This is Local Matters on CBS 17 News at 4.
Well, because the General Assembly is still at odds over the budget, hundreds of thousands of North Carolinians will remain without health care.
The State Department of Health had hoped to expand Medicaid next month. CBS 17's Russ Bowen joins us now. Russ, you had a chance to sit down with the Secretary. It looks like this delay is going to last for months, too.
Yeah, it's very likely Medicaid expansion won't launch until next year. When lawmakers finally joined the majority of states to do so, they tied it to the budget, which, as you mentioned, has not passed. I spoke to the Secretary of Health and Human Services about why this is now an even bigger problem. So when you were here the last time, you had hopes that the General Assembly would pass the budget, get it done by September 1st, so you could launch Medicaid expansion by October. That didn't happen. Not going to happen in October. Then you talked about, well, if that does not happen, maybe December or early next year. What are we really looking at? Let's say if they do get something through in the next couple of weeks.
Well, our team is working very hard to get Medicaid expansion in the hands of 600,000 people as soon as possible. But we're really in a holding pattern right now until we can get something from the General Assembly. It's going to be very hard for us to get something done in 2023 at this point. Time is ticking and we really need their action.
So when you say hard in 2023, does that mean impossible or it's doable maybe?
I mean, we're going to work hard to get it done. There's a lot of things that we have to navigate. Open enrollment in the federal marketplace, navigating the federal marketplace and the technology changes that we have to make to be able to get that done there. Bottom line is that we're probably slipping out of 2023 at this point, but every day counts.
The budget comes out when it's just too late for December period. But you are looking at early January, February, March. What does that look like?
Yeah, we just can't make a firm date until we have the authority at this point to move forward. We had a window where everything aligned in advance of the open enrollment period and a number of other things where we could do that pre-planning. That's how we announced October 1st. As long as we could get the thumbs up by September 1, that window's closed. We've now come into the open enrollment period. The federal marketplace gets incredibly complex. Changes to that have to happen to make Medicaid expansion happen. A number of other things have to happen as well as far as beneficiary notices. Those have to deconflict from the holiday period and mailing. And, we're talking about connecting with 600,000 people, spread across 100 different counties and eligibility workers. It's an incredibly complex operation, which is what makes it so difficult. We're prepared to pull a rabbit out of the hat every way we can to get this done for North Carolina as soon as possible. But until we can get the thumbs up from the General Assembly, it's going to be really hard for us to start to bake those timelines in at this point.
On a human level, subtract the logistical part of all of this, we keep hearing these stories of people who are losing coverage or would qualify for coverage who can't afford to get the care they need or preventative care that they need or treatment that they need. How difficult is it for you and for your staff to hear these stories knowing your hands are tied?
I mean, these stories are heartbreaking, and this is why our team comes to work every day to help North Carolina. Our mission is to improve the health and well-being of all North Carolinians. We have a lot of challenges in accomplishing that goal, but when you have a tool so close that would be so amazingly effective at giving people the resources they need to get access to that blood pressure medication, to get access to the insulin that they need to control their diabetes, and yet it is just out of reach, it's really heartbreaking and tragic, but my feelings and thoughts don't matter. This is about the people that we serve and the challenges that they face, and we're going to try to do everything we can to support them, and I hope that the General Assembly will join us in doing that.
So what do you tell people? What do we tell people to do? I mean, if they're insurance-less for the next 3 or 4 months and they need treatment or they need care or they need to see a doctor, I mean,
tragically, this is a state that 1.2 million people have been in for a very long time. We have a very large uninsured population in North Carolina. They navigate this by often ending up at the emergency department for care, which is not a great place for them to be as far as getting the preventative care they need. It's also not a great place for them to be as far as other folks needing access to the emergency department in a crisis. I think back to March when there was a huge bipartisan agreement to do Medicaid expansion. And here we wait. And every single month, the Medicaid expansion is not on, we're not drawing down hundreds of millions of dollars that would be coming into North Carolina in the form of insurance payments for providers and hospitals to sustain our healthcare system. At this point, over the last 5 months since March, it's billions of dollars that we will never get.
And you bring up a point that I think, we always hit, but we can't hit enough, and that is we're talking about federal money, not North Carolina taxpayer money when it comes to what's coming out of their check for state taxes or whatever fees they may be paying for, across the state. These are federal dollars.
Yeah, North Carolina is a growing state, and people in North Carolina pay their federal taxes. Those dollars go to D.C. This is our chance to get some of those back. And we're leaving them on the table up there, and we've been leaving them on the table for a very long time.
And you can hear how passionate he is about this because he knows what it is like to be without health insurance. He grew up in a family without it, guys. Look, this could take some time, Angela and Rod, because even if the General Assembly, as we're hearing, comes to an agreement this week, it's got to go to the governor. Is the governor going to veto it? Is it going to go back? Is that veto going to be overridden? Or are they going to send it back to the governor yet again? So many unknowns while people are just waiting and waiting for health care coverage.
For
really
a decision
sad
to be made.
Yeah.
Yeah.
All right, Russ, thank you so much.